All right, we are live, so we're going to go ahead and get started with our live stream today. Hi, everyone. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. And today we have a little bit of a different live stream. We're not going to be talking about COVID-19, but I have a special guest here with us today, Zach Palmore, our new data scientist at the Rock County Public Health Department, is here just to share a little bit about his role in this new position for our department and what that means. And he may be joining us on some future live streams talking about the data. So without further ado, we're going to get into the content. If you do have any questions, you can always put those into the chat box and we'll try to answer questions at the end of the live stream. But we're just going to go through and have a little chat with Zach and learn a little bit more about his position within the health department. So with that, Zach, our first question for you today is what is a data scientist and what does the data scientist do?
Let me unmute myself here. Good question. So I guess in short, a data scientist is just someone who uses some methods, tools, and processes to extract insights from data. Typically that means, you're building on like some math and statistics and how to validate information and get quality and, reports or some kind of dashboard, for example, information that we can present to the public in a more reasonable way and ensure that it's correct and not skewed in a particular direction. And it also builds on some computer science and some IT skills that might not be as common to some more data heavy people like Nick. But I think there are many tools that we use that would overlap and we can start to talk about how we might go modernizing our data structures in Rock County.
Yeah, I think that's an important point as we talk about the future of our public health department. We're really trying to be a data-informed department. And it starts with having staff people who are data experts and have expertise in the field. And so do you want to just give us a little brief history of your education and background and kind of what brought you to the position at Rock County?
Sure. You mean what made me come out to Rock County? So my previous work was as a consultant in the environmental industry, and we focused a lot on energy and how we could build some sustainable systems within large corporations. We had clients all across the U.S. and we were based out of New York. I was from Virginia, so I'm originally not from Wisconsin. It's a lot colder here. I've noticed that everyone tends to wear that as like a badge of honor. And I'm thinking, wow, it's freezing. I'll eventually get used to it. But, it's definitely a change. So I guess that's a bit of my background. And then, education, it takes a graduate degree and a lot of experience and learning from the things that you encounter in the real world, obviously are no different or are very different from what you'd experience in a controlled setting. So you need a lot of background knowledge of how you can go about improving a data system and what the data system currently exists, which is where we're at with my new role.
Gotcha. Nice. Getting a phone call here. Anyways, so I know it's been a little over a month that you've been with the department so far, but can you give some ideas of specific projects that you'll be working on or the types of projects that you're looking forward to working on in the future?
Of course. Some of those I think you and I will be involved on, especially like disease surveillance and all the COVID numbers that you've been putting out. Hopefully we can make your processes a little more efficient, shall we say, use some of those modern tools that we have available to us to limit the amount of time that you spent working over working hours to get data information and specifically COVID out to the public. And then there's a lot of operations improvements that we can make within the county. Of course, starting in public health, because that's where we're focusing right now. But I fully expect that as we solve some of the problems that other areas will see, we need help, and we'll be extending our services, so to speak, to those who need it most.
Definitely, yeah. So as I mentioned, the work that we do at the Public Health Department, we try to be data informed and use the best evidence available to us for our decision making, but also to inform the programs and services that we have available for the community. I don't have a whole list of additional questions for you, but is there anything else that you wanted to share on the live stream today?
Not in particular. I mean, I'll say that we are working on getting the goal of anything in data science to me has always been getting higher quality information to those who need it faster. And so that's going to be a huge impact to those who are using any information that the public health department supplies or builds itself off of. All of our information all of our insights are supposed to be data driven, and we have new initiatives now that are talking about moving into a modern data driven infrastructure. And currently we are in need of a lot of improvements in those systems. So I'm excited to be here and excited to work with you, Nick, and Jessica, and all of the other people who are in the public health realm right now. And I'm excited that we'll probably even branch out farther than that once we get going.
Well, I'm particularly excited, but we're all very excited to have you on board. And I'm just gonna share my screen real quick. So for those who are viewing the live stream right now, we do have a revamped website, and we talked about that at the last Numbers with Nick live stream, but I did want to show you the way that you can connect with us. So Zach and I have connections to this website, and we're informed if people want to make contact with the health department. There's a link here on our health department website, and you can make a data request. So we do have that option for folks out there. If you're looking for specific information, or if you represent an organization and you'd like some data analysis, Zach and I will be looking at these requests and hopefully entertaining these requests and fulfilling these requests as people have them. So you can always fill out your information, the organization that you represent, and the type of analysis that you're looking for as we move forward and kind of out of the worst of COVID-19. Hopefully we'll be trying to focus our efforts on broadening our scope of the types of services we provide for the health department, for Rock County, and also for the community. So just wanted to throw that out there as well. I don't have anything else that I wanted to cover for the live stream today. You may see Zach again on a future live stream, depending on the topic of the conversation. Moving forward, I think we're going to be transitioning away from covering COVID-19 exclusively, and we'll be thinking about other health topics and the data related to other health topics. We also, you may see a decrease in the frequency of these live streams. So we may go to an every other month or every other quarter type of a schedule. So be on the lookout for further communications on our Facebook page and our social media. I'm gonna check the chat just to see if any questions had come through. And we just have one comment from Barb, who says, "Welcome to Rock County, Zach." So wanted to pass along that welcome, and thanks, Barb, for the warm welcome.
Thank you, Barb.
We're going to, let's see, there's no more questions, it looks like. So we're going to close out the live stream today. If you do have further questions or future questions you'd like us to address on a future live stream, feel free to reach out to us via social media. But until then, we'll see everyone in a few weeks or maybe a month from now. Take care, everyone.